just want to add a comment on here. Excellent. So here we are. Let me just look at this. Okay, chat filter. If you're just joining on here, just give me 1 second. I'm just having a look at all of this. Okay, I think I've got it figured out. This is my first YouTube live. I've done quite a few on TikTok, but this is my first one on here. So I'm just trying to figure it all out here. It's a little bit different from TikTok, but that's okay. Excellent. Okay, so here we're going to get started here. So welcome everyone. My name is Paige. I'm a nurse. I've been a nurse for 32 years. I have worked in emergency rooms for a long time. I worked in intensive care units. I flew with air ambulance, and now I'm a patient advocate. So I help people navigate the healthcare system. And if you've watched my videos, you kind of know what I'm passionate about, and there's certain topics that I'm more passionate about than others. And I have the most amazing people on here with me who offer really good comments and ask questions and offer support to other people too that are watching the videos. That's one thing I really love too. And so my heart is to really create a community where we can talk openly about the healthcare system, all the pain points that happen in the healthcare system. And so if you have questions, please put them into the comments. If you want to share an experience that you've had in the healthcare system, go ahead, put it into the comments. I will do my very best to keep track of them and keep up with them and answer them. And if for some reason I missed them, which is highly possible, then just write it in again, or just kind of, type your question in again. And if you're just joining, hello, welcome. I'm glad that you're here. And we're just talking about the healthcare system and all the different things that can go wrong in the healthcare system. And if you have questions, make sure you put them into the comments. And or if you want to share anything that you've kind of experienced. And anyways, and if you're just joining, welcome. My name is Paige. I'm a nurse. I've been a nurse for 32 years. I've worked in emergency rooms, in trauma, ICU. I've flown with air ambulance. I've done a little bit into, hi, Big Hamster. Hi, I'm glad that you're here. I'm now a patient advocate, so I help people navigate the healthcare system. So, and if you've watched my videos, you'll know the different things that I'm passionate about. There's a lot of pain points in our healthcare system, as we all know, and a lot of ways that people fall through the cracks. And it just really, it breaks my heart that when that happens. So that's why I started patient advocate work, and that's why I've started these channels. I originally started, I'm an author as well. Hi, Simone. And if I say your names wrong, I'm really sorry. Hi, welcome. I'm glad that you're here. And yeah, if you guys have if there's questions or you want to share experiences that you've had, go ahead and put it into the comments, and I'm going to do my very best to respond to them. Let me just make sure I can do that. So this is my first YouTube live. I've done lots of TikTok ones, but this is my first one on here. So Natalie, hi. Metro Bro, hey, welcome. I'm glad you guys are here. So I'm just gonna kind of get started here, and like I would rather hear from you guys about questions you have about the healthcare system, or sharing different experiences that you've had, and we can kind of talk about this. So Metro Boy, so I'm a nurse. I've been a nurse for 32 years, emergency room nurse, trauma ICU. I've flown with air ambulance, and now I'm a patient advocate. So I help people navigate the healthcare system. And so we're on here just talking about all of the different ways people can fall through the cracks in the healthcare system, from being dismissed by your doctor to not getting proper treatment when you're in a hospital, or getting discharged from a hospital, long wait times, like when to go into emergency, or when all of your doctors are not talking to each other, which is a common thing that happens. People not getting a diagnosis. That's another big one. So yeah, so if you have, I'm here to answer questions. For sure. I'm here to just be available, really. And if there's no questions or whatever, I've got lots of stories. I've got lots of topics that I can talk about. So yeah. So anyways, welcome. I'm glad you're here. So I just thought I would try and do. I've had like 1,800 something people on my TikTok lives, and I just thought, I love my people on YouTube and you guys just have such great comments, and you're just asked really good questions. So I just decided I wanted to be available on YouTube as well, to help. Can you tell me a story from your experience? Oh my goodness, I have so many stories. It's hard to even know kind of where to go with that, because there are so many stories from, a lot of them are in the emergency room, like, people understanding what the emergency room is. And I was going to just talk about that. Maybe I'll just talk about that a little bit now. Like one of the most common questions that I get, you follow, hi, the kids, you follow on TikTok. Awesome. Good to see you on here. Yeah, like Metro Boy, I honestly don't even know where to start. Like I have so many questions. Flynn Forever, can you share your favorite moment from working in healthcare? Oh my gosh, I have a lot of those too. A lot of really, I don't know if I can pick one. There's so many, because I worked in the intensive care unit, the trauma unit, for a long time as well. And there were some really profound moments in there. Like people, I remember one time I had a burn patient that had a really significant burn, and it wasn't looking good that they were going to survive, but they kept fighting and fighting. And it was a young woman, and she just kept fighting, and she pulled through. And I'll never forget the family, like the family response to her. And she was just such a fighter. So there was a lot of death in my work for sure, but there was a lot of really amazing things like that. Yeah. Hi, Flynn. Hi, Taylor. Yeah, it was just like amazing. And like I was saying earlier, I've been a nurse for 32 years. So that's a long time. And what ended up happening was my mom got sick, with cancer. So I became her caregiver. And so for about 2 years. And so that's, if you've ever been a caregiver, oh my gosh, like you have a lot of time on your hands. You're doing a lot of sitting, a lot of thinking, a lot of reflecting. And I'm a nurse, like I know what questions to ask. I know who to ask questions to in the healthcare system. And I know how things are supposed to run. And I was having a hard time getting answers. I was having a hard time communicating and getting the proper care for her. And I started thinking, like, what do people do that don't have a nurse in the family or someone that knows this stuff? So that's how I started my patient advocate business. So so that's kind of how that happened. And I haven't looked back since, because I have a real passion for helping people that don't maybe know how the system works, right? Or maybe they can't speak up for themselves, or when you're sick, and especially any kind of sickness, whether it's like an acute thing that happens quickly, or you have a chronic illness, or there's mental health, or like there's so many different things. And it's exhausting. And when you're constantly, the way our system is kind of broken right now, it's exhausting to always be advocating for yourself. So I kind of, my videos sort of highlight some pain points that maybe people don't know. It's not intended to scare anyone. It's definitely not intended to, thank you for the hearts. Thank you so much. It's not intended to frighten people at all, or to really come down hard on like doctors or the healthcare system, because I know a lot of amazing doctors out there, and it's just our system is broken right now. And anyways, thank you for all the hearts, you guys. Metro Boy, I used to take care of my mom. She passed away. I'm sorry for your loss. Yeah, my mom passed away too. And she's lucky to have you, because to be, and I also understand the being a caregiver it's an honor in a lot of ways. Like it is, I felt it like it was an honor to be able to look after my mom, but it's also exhausting, and it's caregiver burnout is a real thing. And if you're just giving of yourself, and then I would start to feel guilty. Well, maybe I'm not doing enough, maybe, and then other areas of my life were kind of being affected, right? Because all of my focus was on her, and I wasn't taking care of myself. And really, you know, that saying, you can't pour from an empty cup, like you can't give away what you don't have. So, but a lot of people in the caregiving role, they just dive in with all of themselves, and you know, and it's exhausting. So I like to advocate for that too. So yeah, really, really, really great. So anyway, thank you for sharing that, Metro Bro. And if I say your names wrong, just bear with me. I'll do my best. And if you guys put a comment in or ask a question and I miss it, please just, like, I don't know, virtually raise your hands up or whatever, or type it in again. So yeah, thanks for sharing that. That's really, it's tough. Did you have any, I'm just curious, did you have challenges as a caregiver looking after your mom? I'm sure there were. I'm sure it's emotional for one. It's hard to watch your parent decline, for sure. Yeah, I get it. It's tough. It's very, very tough. So I was just going to talk a little bit about how to know, like, should I go, if you're not feeling well, right, or you're hurt or whatever. Like, one of the common questions I get is, like, should I go to the emergency room? Should I go to urgent care? Or should I just wait at home and see my doctor? And I totally get it. It's really confusing. You don't want to overreact, but you also don't want to ignore something serious. So I was just going to kind of break that down, because I think a lot of people don't really understand, like, I guess as a precursor to, I'm not a doctor, so I have to say this, like, if you are in doubt, go to emergency. I need to say that, just because I don't want to, you know, to stray you or lead you astray. So when to go to the emergency room, the ER is for life-threatening emergencies. So that means things like chest pain or pressure, you know, that could be a heart attack. For women, it can show up a little bit differently. Difficulty breathing or shortness of breath, severe bleeding that won't stop, head injuries where you hit your head and you lose consciousness, like you go out of it. Severe bleeding, sudden, like, severe headache that won't, like, the worst headache that you've ever had, and it just won't go away. Any signs of stroke, so like facial drooping, arm weakness, speech difficulty. If you have a severe allergic reaction, if you have a high fever and neck pain or confusion that goes along with that. Severe, I won't go through all the things. These are just kind of the main things, like broken bone, like major broken bones, severe abdominal pain. But, like, if you're asking yourself, could I die from this? Go to the ER. Like, don't mess around with that. And then there's urgent care, which is kind of a step down. Urgent care is for things that need attention today, but maybe they're not life-threatening. So things like minor cuts that might need stitches, or minor burns, or if you sprain your ankle or strain a muscle, ear infections, sore throats, UTIs, vomiting and diarrhea. Like, as long as it hasn't been going on for days, you've got kind of a bad stomach, minor eye injuries. Basically, if it's something that can't wait for your regular doctor, but it also won't kill you, then that's when to go to urgent care. It's faster. It's a little bit quicker to get in there. And when to wait, then there's a third option. When do you wait? And just wait and see your doctor. So it's kind of for more like regular things, like where it can sort of, you get bullied because, this is Metro Boy, bro. I keep calling you Metro Boy because I have a bad shuddering thing. So do you mean in your speech, or do you mean like you have tremors, like you shake? I'm really sorry that you get bullied by the healthcare system. It is, I've talked in my video, your speech, so then it's hard to communicate, I'm guessing. One of the things, I wonder if it might be a really good thought for you to have a medical, like a binder, or, you know, something written down. And I like this for all of my patients and clients anyway. But especially if communication is tough, just having it all written down, or before you go in, if you have time. I mean, in emergencies, you don't always have time. And I'm guessing probably stress makes it worse, or if you're in pain, or if you're sick, like, I'm guessing those kind of things might make it worse. But to kind of have a baseline at least written down, or even in your phone, if you have a phone, you know, your cell phone, and you could just kind of show it to them. just for if you start to get, if that starts to happen, because that would be hard, I'm sure. And then if you're feeling judged and you're being treated different because they aren't understanding what's going on for you. But that might be one thing to have. The other thing that I'm really passionate about too is bringing someone with you. And this is for everybody, whether it's going into the doctor's appointments, definitely for major important doctor's appointments, and also in the hospital, having somebody there for you is huge. It can be a total game changer because they can be an extra set of eyes and ears. So our ability to retain information from a doctor is really low, and that's if we're feeling well. So if we're not feeling well, it just kind of goes way down. So they can take notes, they can help us ask questions that we might forget. Some people get like white coat syndrome where they just kind of freeze. The other thing that can happen too is people if a doctor's not believing you, what your symptoms are, the person that you bring with you can say, well, actually, I've seen him, in pain, not be able to sleep because of his pain. He hasn't been able to work because of his dizziness or whatever. Like, I'm just making stuff up, but they can actually concur and validate your symptoms, which helps back you up if you're in a situation where your doctor, isn't listening to you. Sixth place. Hi, Paige, you're pretty awesome. I feel so peaceful listening to this. Oh, good. That's awesome. And if you're just joining on here, thanks for sharing that. My name is Paige. I've been a nurse for 32 years. I've worked in emergency rooms, trauma, ICUs. I flew with air ambulance. I worked a little bit in mental health. So I did inner city detox, so addictions nursing. And then now I'm a patient advocate. So I help people navigate the healthcare system, not just in the hospital, but in the community with their doctors. And so that's kind of what my channel is all about. That's also what these lives are about. This is my first live on YouTube. I do a lot of them on TikTok, but I wanted to come on here too because it's a different group of people on here, and I want to be available to answer questions. So if you have questions, just put them in the comments. If you want to share something, an experience that you've had that you want to talk about, or just even to share and get it off your chest or whatever, that's what I'm here for. So I've got lots of topics that I can kind of talk about. Somebody asked, Metro Bro asked, can you just tell one story from your nursing? And there's just so many that I don't even know where to start. But probably as we're going along and we're talking about different things, then I'll be able to kind of communicate about that. But yeah, if I miss anything, just let me know or put it in the comment again. And if you guys know anybody that you think might benefit from this conversation too, I'm gonna do about one live a week on here. So but if you do know somebody, just share this and bring them into this conversation. And anyone that you think is struggling with the healthcare system. But there are so many pain points in our system. There's so many ways people can fall through the cracks. So I've had a couple of people on my videos say, like, you're freaking me out. Thanks for the hearts and the likes. You're freaking me out. Like, that's not my intention. I just want to raise awareness of things that can happen. And I feel like if people are informed of kind of just not to be hypervigilant or on guard or suspicious or any of that stuff, just to some information, just tuck it in the back of your head and just to kind of keep that in your mind to, just advocate for yourself. And I get it. It's exhausting advocating for yourself. Like, it can get really, really tiring. So that's why I'm so passionate about having other people around. And you know what? Not everybody has other people too. So, but like, if you're in a doctor's appointment and you don't have anyone to go with you, is there somebody even at work or a professional? I have one client who asked his postal carrier, like the guy that brings him his mail, if he would be willing to listen in on his speakerphone in an appointment because he didn't want to miss anything and he just wanted an extra set of ears listening. So yeah, anyways. So anyway, that's kind of what I was thinking about. About the difference between like when to go into emergency. And I've talked about this before too, like the way that the ER department works is it's not a first come, first serve. And which, that contributes to the long wait times, right? So it's kind of whoever's the sickest gets seen first. So, and I know I've been in that situation where I'll go into the emergency room, I'll be sitting there for 4 hours, it's almost my turn, and then somebody comes in after me and they go in right away, and it's like, what? But it just happened, like they were sicker. And so, I mean, the more life-threatening things go in first, and it can be daunting for sure. And you can go up to the triage nurse again and just say, hey, like, where am I in the line? Like, where am I in the queue? Definitely, if your symptoms start getting worse, don't just sit there and wait. Make sure you go up and let them know, and they can re-triage you. I also like to tell people, like, to bring your binder that you have, having everything kind of written down with your symptoms that you're having, when it started, what things are making it better, what things make it worse. And then, yeah, just have your binder like that, kind of bring it with you. And and then sometimes you just gotta wait, unfortunately. Another little tip, and Metro bro, my cousin is watching with me. Oh, awesome. She said you're the coolest person. Aw, thank you. That's so great. Thank you. I love doing these where there's some interaction. I have done them. Well, actually, I haven't done too many where there isn't interaction, but that's, I mean, I could just do my own talking on my videos, but this is what I like, is to kind of what you guys are needing. One of the other problems that I've seen a lot, and I've done quite a few videos on them, is hospital discharge. Like people that are either discharged from the hospital too soon, or they're discharged without proper resources, or they are just kind of not even really treated or seen or investigated, and then they're booted out. And that happens for a lot of reasons. Like, the hospitals are over capacity, so there aren't enough beds. Just like there aren't enough doctors, there isn't enough money, like there's all this, but there's a bed shortage in the hospital. So then the administrators, okay, bye Metro Bro, thanks for popping on, see ya. So the administrators will come and they'll say, well, we need beds. So then they'll kind of go through the hospital and see who they can discharge. And sometimes it's before people are ready, right? And I've seen it with older people. They might discharge them home, but they're not. There's no one at home to help them. And like that stuff's just not okay. So just really being aware that those things can happen is really, really super important. And a lot of people think like once you're discharged from the hospital, you're all set. But the truth is the transition from hospital to home is one of the most dangerous times for a patient. Like mistakes happen, information gets lost, people end up right back in the hospital sometimes, and that's not good for anybody. So I really want you guys on here to like just know how to protect yourself or your loved ones. So before you leave the hospital, just really make sure you understand, like they should be giving you discharge papers. They should be going through those with you, but really understand like what happened to you in the hospital. Like what was your diagnosis? What was your surgery? What treatment did you receive? And you should be able to explain this back in your own words. You really need to understand it. You wouldn't believe how many patients I've seen who said, well, I was in the emergency room, but I don't really know what happened, right? Or what the outcome was. So really important. And if you need them to write that down, then get them to write it down. That is totally okay. Ask them like what medications you're supposed to take, what symptoms to watch for, how would you know if you needed to come back into the emergency room, those kind of things, right? So really important to do that. Anyways, that's another little thing I'm passionate about, is people that get discharged from the hospital without the right resources. So anyways, I will leave it at that, but just want to see if anybody on here, I just want to scroll for a minute, see if anybody has any questions at all. Can you guys can hear me okay? I'm assuming. I think I can be heard. If you're just joining on here, my name is Paige. We are talking about healthcare and all of the ways people fall through the cracks in healthcare. I've been a nurse for 32 years, so I've seen a lot. I'm a patient advocate now, so I help people navigate the healthcare system, kind of all the little nooks and crannies and ins and outs of the healthcare system. Another really important thing, in my opinion, is preparing for doctor's appointments. I mean, we all know that, especially specialist appointments, it can take months to get in. You don't want to waste the time. And even with your family, your primary care physician, you have like 7 minutes or something, right? Like you don't have much time. And now they're starting to limit the number of topics or the number of issues that you can talk about. So it's really important to be prepared when you go in and have your questions written down. But especially if you're going in with a specific symptom or question, make sure you've got, like, instead of just saying, I've been having headaches, be really specific and write it down ahead of time. When did they start? How often did they happen? How long do they last? How, really detailed what things help, what things make it worse. Make sure you have a list of all your medications too. Just make sure that everything's written down ahead of time, and then write down your questions. Like, sit down before your appointment, write out every question you have, and like all of them, even the ones you might think are dumb, and bring the list with you. But make sure you kind of prioritize, like circle the top 3 questions. Make sure you ask your first question, your most important question first. So, and then if it's a complex thing, like, bring someone with you. I think it's just a really great idea. You can ask to record your appointments. And one thing I notice, and I don't know, I think women might be a little worse at this, or they're more or better at this, whatever, but they downplay and minimize symptoms. So I'm not saying exaggerate your symptoms, whether you're going to the emergency room, whether you're going to see your doctor, or you're seeing a specialist. Don't exaggerate them, but don't undersell them. Like, don't minimize them. Be really accurate and really as clear as you can. And that's going to give your doctor the best chance of helping you. And if you're in a situation where your doctor is kind of gaslighting you, that's sort of the term used, and telling you it's in your head, or it can't be that bad, or it's anxiety, or whatever, that's even more important to have it really specific, like have it listed down really, really specifically. Just gonna take a drink. I'm just gonna scroll on here because I don't want to miss. If you guys have questions or you want to share anything, please put it in the comments. Anything about anything really healthcare related, I'm happy to talk about it. I just don't want to miss anything. And if for some reason I miss something that you say, make sure you put it in again. And if you've been on here since the beginning, I know I sound like a broken record, but different people are popping on all the time. My channel, actually, hi Ava and Paisley. Oh, hi, I'm glad you're on here. Welcome. My channel was originally, so I'm an author as well. And so I've written a bunch of different kinds of books. And some of my patients said, well, you're an author and you've got all this medical knowledge. Why don't you combine them? So I wrote a book too. So that's kind of what this channel was supposed to be. And then it manifested into this. But this is my book here, Unlocking Healthcare. And it's this isn't a book pitch live at all, but I just thought I'd mention it. But it's a guidebook. So I'm really nerdy. So it's got like all the chapters and sections are color coded, and then you find, so it's everything from knowing your rights as a patient, mental health, understanding tests and referrals, understanding your benefits, newcomers where English is a second language. There's a whole section for that. There's Indigenous health, LGBTQ, rural and remote care, seniors, end of life stuff, caregivers stuff. So anyway, that's the book that I refer to in my videos. Yeah, Toral Face, hi. And if I say your names wrong, please forgive me. Hi, welcome. I'm glad you guys are here. Okay, so I might just kind of go on. If you guys have questions or comments, please don't hesitate to put them in here. I want to hear from you guys. I don't know if any of you have experienced this when when doctors kind of dismiss you. Oh boy, it's a big one. To be honest, it makes me quite angry. And there's a lot of really great doctors out there, and unfortunately, there are some who also are very dismissive and disrespectful, and it happens all the time. And it happens to, like, ageism is a thing. So people that are young get told that, well, you're too young, or maybe they look healthy from the outside, but maybe they have a chronic illness that you can't see, but you're too young, you can't be that sick. Or ageism on the other side, it's almost like once you hit a certain age, you just don't matter anymore. And I've heard doctors say, well, can't you tell me one thing that isn't related to your age that's wrong with you? It's like, it doesn't matter how old you are, you still deserve good care, and you deserve to have your symptoms investigated. Anyways, that kind of fuels my fire a little bit when I see that stuff, but it happens. Different races get treated differently, different socioeconomic, whatever status, I guess, it gets treated different, and that's just not okay. So anyway, that's my little soapbox on that. But so talking about, it's called medical gaslighting, really is what it's called. It's the term now. And did you know that there are counselors right now who are specializing in medical PTSD counseling? Like post-traumatic stress disorder from the medical system is a thing, and people are suffering from it. And so there's counselors that are starting to more and more specialize in that, which I think is great, because I've seen a lot of people who are traumatized by a system that is supposed to care for them. So anyways, and I said this earlier, there are a lot of awesome doctors out there. There are a lot, but unfortunately they're not all equal. And so I think it's important to kind of, just be aware of some of this stuff. So I just need you guys to know when this stuff's going on, like, you know your body better than anyone. And if something feels wrong, it probably is. And you have the right to be taken seriously. Like, these are rights that we have. Ask if your doctor's kind of dismissing you, or telling you it's all in your head, or not believing your pain, or all the different things that can happen. Ask them to document that in your chart. Like, it's amazing what that can do. Just kind of saying, I need you to document in my chart that you're declining to investigate my symptoms. So just saying that can actually make them reconsider. And because if they document that they dismissed you and it turns out to be something serious, they could be liable, right? So, and then also, can you explain to me why you think this isn't worth investigating? They say to you, I think it's just in your head, or I don't really believe that your pain's that bad. Well, why? Why do you think it's not that bad? Or can you explain that to me, why you think it's not something worth investigating or doing blood work for, or sending me for a CAT scan for, or whatever, or to a specialist? Just make them justify their decision. And sometimes when they have to explain it out loud, they realize that they're being a bit dismissive, or they're just trying to rush through something. Nitronic, hello, welcome to our little chat here. And really, we're just talking about medical gaslighting, and when doctors dismiss you, or don't believe you, or try and tell you that it's in your head, or if mental health is it's a illness, right? Like, it is. And so, but sometimes they get it backwards. They say, well, you're just anxious, and that's why you're feeling these physical symptoms. Okay, maybe, but I'll tell you what, if I had a chronic illness of any kind, that was persistent and ongoing, well, actually, anytime you bet I'd feel anxious, probably a little depressed, very stressed. So, I still have these physical symptoms that need to be investigated, and these other kind of mental health things might be there as well, but they put it the other way around, right? So it's just not okay. I think it's good to investigate the whole picture, and our mental and physical health, really, they mesh together, like they go together. This is just my opinion. And if you're just joining on here, I've been a nurse for 32 years, so I've seen some stuff. I'm a patient advocate now, so I help people navigate the healthcare system. So we're talking about ways that people fall through the cracks, the different pain points in our health system. I mean, our system is very overstretched, and our resources are depleted. So I don't know, do you guys have any questions, or should I just kind of keep chatting about stuff here? I've got lots of stuff I can talk about. I love questions. I love if you guys have an experience that you've had in the medical system that you want to talk about. I'm all over that, to kind of dive into some of those things, but totally good if not, if you just would prefer to watch. And if you know anybody that you think would benefit from this, hi True Quiet, If you know somebody that would benefit from this, if you know someone that is struggling with something in the healthcare system, just share this and bring them into this conversation. I'll stay on for probably another half hour, however long. If we get some people sharing, then it's hard to stop. On my TikTok lives, we get going into some all kinds of directions with all kinds of conversations, because really, most of us know somebody. If it's not ourselves, we know somebody that's been impacted by the healthcare system in maybe not the best way. Maybe they haven't been treated properly, or they've been discharged from the hospital too soon, or they weren't taken seriously by the doctor, or it took them years to get a proper diagnosis, or I could go on, but yeah, so most of us know somebody that's been affected in some way, for sure. True Quiet, thank you for your channel. I'm so tired of being dismissed and passed off. Absolutely. I don't know if you missed what I was just talking about here. I could talk about it again. We were just talking about that very thing, and how, it makes me angry, and it's just not okay. And especially if you've had something going on for a long time and you're feeling crappy and you're exhausted, it makes it even worse, right? And so I'm really sorry that you are experiencing that. So I don't know if I'll ask you a question anyway. Is it are they not taking your symptoms seriously, or are you not getting referrals to people that you need? You're not being properly investigated? That's really, it's exhausting. It's exhausting. So thank you for sharing that. I know those things aren't easy to share, and there isn't really anyone to listen in our healthcare system. And I've seen this a lot, and I've had a lot of my clients now, they'll come and say, like, nobody will listen to me at all. Like, no one will validate that I'm feeling crappy. And that's just not okay. That as medical providers, that's kind of our job, right? Like, anyway, but if you want to share any more about that, True Quiet, your last appointment, she kept putting brain fog on the air quotes until she saw it as this. Oh my goodness. Yeah, that's not okay. So she was totally minimizing brain fog, which is obviously one of your symptoms. And that's no joke. That's a big deal. It's like trying to go through life with, I can't even think of a comparison. Not a visual fog, but like where you can't remember. Nothing feels clear. Everything feels foggy. I'm really sorry but I'm glad that it sounds like she eventually did, clue in that it was actually a real thing, but it doesn't sound like she's getting, I don't know if you're getting treatment or proper investigation for that, but yeah, that's awful. Do you keep, is anyone on here, do you guys keep, organize your own medical records? Do you keep a binder of some sort? Because that's really important too. It was a new GP, and I'm just trying to get a neurological referral for a TBI. Yeah, so when you say trying to get a referral, are they refusing? Like, you definitely need a referral. If there's something cognitive going on, neurological going on, you definitely need a referral. So I don't understand why so many doctors resist giving referrals, but they do. And I do not understand why. Like, it's not like they lose money if they give a referral. So I hope you get one, and I hope it's not, 3 years down the line. It sounds like you need to be properly investigated. They sent the referral, but you're still waiting for a call. Okay. So one thing I believe, and I've seen this happen, is human error can happen. So I would follow up. I would phone the neurologist, like phone your clinic, the doctor's clinic, get the name of the neurologist that they sent the referral to, call that clinic, and just to make sure that the referral was actually sent. Because that's mistake number one that I've seen a lot, and people will wait months. I had one lady, she had waited a year for it was actually neurology too, waited for a neurology referral for 1 year. And I said to her, well, maybe you should call, just check, like, are you sure that it was sent? She was like, well, I'm sure it was. My doctor said that they would send. She just assumed that was how long the wait time was. She phoned there and it had never been sent. So that was like a year wasted. So I plan on calling tomorrow, followed up Friday, and got the number to call. Oh, good. If you didn't hear by today. Awesome. Yeah, just call. Make sure that they got it. First of all, ask when your appointment is. Hopefully they'll have a general idea. And then ask to be put on a cancellation list too. That's what I would do. Because people do cancel, especially coming into winter. Good. Oh, you're totally on it. That's awesome. I hope that you get some answers from that. That's hard. I'm just scrolling here. And the other thing you might have missed, but earlier we were talking about, and if you watch my videos, you'll know how passionate I am about bringing people with you to your appointments. And that's a big deal. So especially something big like a neurology appointment, like a specialist, I would definitely bring someone with you if you can, and even record it and prepare for it. Like, you get such a small window of time, and it's a really important appointment. So just being really super, and if you know all this, just ignore what I'm saying. But it's really like being as specific as you can, like when your symptoms started, what they look like really specifically, give them some examples, what things make it better, what things make it worse. Just be really, really clear. And I like to suggest writing it down ahead of time, because it's super easy to forget, especially if you're not feeling well that day, or you didn't sleep well, or whatever. And bring someone with you to take notes. Good job. Yeah, you're totally on it. You're calling tomorrow. Okay, so I don't know. Do you guys have any other questions at all? I might hop off if there aren't any questions, but I hate to leave when if there's anything else that I can offer for help. This is my True Quiet. Oh, Metro Bro's back. True Quiet. I brought my boyfriend, the only person I feel safe with, and she dismissed him for being a man, and she said she wouldn't want her husband with her. That's not really, you don't care about that. Like, who cares? Why would she say that? It's actually the other way around. Well, male doctors anyway, and female doctors, they respond a little better when there's a male in the room. Our system is still very patriarchal. I'm generalizing, obviously, but I've seen, I know for me, I bring a man with me when I go, because just like if I go do something with my car, it's crazy. So I think that's awesome. Yeah, and if you feel comfortable with your boyfriend there, that's all that matters. And that's funny that her preference isn't my problem. Totally. How would you even respond to that? Okay, so you wouldn't want your husband there. That's fine. What an odd thing to say. People are funny sometimes. Thanks for sharing that, True Quiet. That's great. Well, hopefully you don't have too long of a wait. And then I would call back like every couple of weeks and just sort of check to see where you are on the list. Your brain glitched, I imagine, when somebody says something like that. What an odd thing to say. I haven't heard that one before, where they actually disclose that. That's pretty funny. Oh my goodness. That's crazy. I'm just looking. I just don't want to make sure I don't miss anything. Yeah, so, and definitely get on the cancellation list too if you've got I wonder, well, see what the wait time is, and if it's like crazy, like a year, it might not be a bad idea to get a second referral out too. Sometimes we'll sort of do that and just send out a bunch, but it depends on the doctor. Some of them just won't do that, unfortunately. Scrolling. Okay. So yeah, that's great. So I'm gonna probably hop off, and I'm gonna try and do one live on here. Spend more time waiting than anything. Oh, the whole healthcare system is just, it's a big waiting game, isn't it? You wait when you go to your doctor's in the waiting room is the first thing that happens. It's just crazy. Yeah, and then the emergency room. Thank you. Yeah, you too, True Quiet, and thank you guys for joining on here. And I might advertise it next time. I just kind of hopped on a whim. So, but thank you for sharing, and make sure you subscribe to my channel so you can get my videos, and we'll see you guys next time. And if you think of any questions, like if anything comes up, just send me a message, and I'm happy to help in whatever way I can. And I'm also on TikTok too, if that's a little bit easier. I'm just trying to, oh no, you can write messages under the videos. I'm just not sure. I haven't used the community page on here yet, but I think that's another way to send messages. But anyways, okay, have a really good night, you guys, and we will talk to you soon.